Welcome to Doctor Next Door, where we simplify complex medical concepts. Today, we're making heart failure simple.
Signs and symptoms of heart failure explained simply. When the heart becomes weak and can't pump blood properly, the body starts showing warning signs. Here are the common ones, explained in everyday language. 1. Shortness of breath, difficulty breathing. You may feel breathless while doing small things, like walking, climbing stairs, or even lying flat in bed. This happens because fluid builds up in your lungs, making it hard to breathe easily. 2. Swelling, edema. You might notice swelling in your feet, ankles, legs, or even your stomach area. This is because the heart isn't pumping well, so fluid collects in different parts of the body. 3. Tiredness and weakness. You may feel unusually tired, weak, or unable to do your usual activities. Since your heart can't pump enough oxygen-rich blood, your muscles don't get enough energy. 4. Faster irregular heartbeat. Your heart may beat faster to try to make up for its weakness. Some people feel their heart racing or fluttering in their chest. 5. Cough or wheezing, especially at night. A persistent cough, sometimes bringing up frothy or pinkish mucus, can happen when fluid backs up into the lungs. 6. Weight gain from fluid retention. Sudden weight gain over a few days, like 2 to 3 kilograms, may be due to your body holding onto extra fluid. 7. Loss of appetite or nausea. When fluid builds up in your stomach,
fatigue
it can
and
make you
weakness
feel
of the
full
body,
quickly or not
reduced
hungry at all.
exercise tolerance,
8.
weight gain,
Confusion or
shortness of
difficulty
breath, especially on
concentrating,
exertion
especially in
or
older
when lying
adults.
flat.
Because less
Fatigue and
blood
weakness
reaches
of
the
the body,
brain, some
reduced
people may feel
exercise
dizzy or
tolerance,
confused.
weight gain, shortness of breath, especially on
Light
exertion
bulb in
or
short,
when lying
heart
flat.
failure doesn't happen overnight. The symptoms often appear gradually. If someone notices they're getting more tired, breathless, or swollen without a clear reason, it's important to see a doctor early. Causes of heart failure. Heart failure doesn't happen all at once. It usually develops slowly over time when something damages or weakens the heart. Here are the main causes, explained in plain language. 1. High blood pressure, hypertension. When your blood pressure stays high for a long time, your heart has to work extra hard to push blood around the body. Over time, this constant pressure makes the heart muscles weak and tired. 2. Heart attack, coronary artery disease. A heart attack happens when blood flow to part of the heart is blocked. The part of the heart muscle that doesn't get enough blood becomes damaged, and when that area can't pump well, heart failure can develop. 3. Heart valve problems. The valves in your heart act like doors, helping blood flow in the right direction. If a valve is too tight or leaking, the heart has to pump harder to keep blood moving, which can lead to weakness over time. 4. Heart muscle disease, cardiomyopathy. This is when the heart muscle itself becomes weak or stiff due to infections, alcohol use, or sometimes unknown reasons. 5. Irregular heartbeat, arrhythmia. When the heartbeat is too fast, too slow, or irregular for a long time, the heart becomes less efficient at pumping blood. 6. Long-term conditions like diabetes or thyroid disease. These illnesses can damage blood vessels or the heart muscle itself, increasing the risk of heart failure. 7. Lifestyle factors. Smoking, excess alcohol, being overweight, lack of exercise, and unhealthy diet can all strain the heart and contribute to heart failure. In simple words, anything that makes the heart work too hard or damages it over time, like high blood pressure, heart attacks, or unhealthy habits, can lead to heart failure. First aid for heart failure at home before getting to the hospital. Heart failure is a serious condition that needs medical attention, but there are important steps you can take immediately at home to help yourself or someone else feel better while waiting to see a doctor or go to the hospital. 1. Sit the person upright. Don't lie flat. Help the person sit upright or in a slightly forward-leaning position. This makes breathing easier because it helps reduce fluid pressure on the lungs. 2. Help them breathe comfortably. Loosen any tight clothing around the neck or chest. Open the windows or turn on a fan for fresh air. Encourage slow, deep breathing to calm anxiety and ease shortness of breath. 3. Give prescribed medicines if already diagnosed with heart failure. If the person has already been diagnosed with heart failure and has been given medications by their doctor, they can take their diuretics water tablets such as furosemide Lasix as prescribed. This helps remove extra fluid from the body. If they are on oxygen therapy, use it as advised by their doctor. Warning: never give any medication that wasn't prescribed by a doctor. 4. Avoid salt and fluids for the moment. Don't give salty food, soup, or excess water. This can worsen fluid buildup. If the person is thirsty, give small sips only until medical help arrives. 5. Call for medical help immediately. Heart failure can worsen quickly. If there's severe shortness of breath, chest pain, or confusion, call emergency services or go to the nearest hospital right away. 6. Stay calm and reassure the person. Anxiety can make breathing even harder. Speak gently, stay calm, and reassure them that help is coming. In summary, sit them upright, keep them calm, help them breathe, give prescribed medicines if they have any, and seek hospital care urgently. Treatment of heart failure in the hospital. When someone with heart failure gets to the hospital, the doctors and nurses act quickly to help the heart work better and to relieve symptoms like shortness of breath and swelling. Here's what usually happens. 1. Checking vital signs and oxygen levels. Doctors will first check blood pressure, pulse, oxygen level, and breathing rate. A small clip may be placed on your finger to measure how well your blood is getting oxygen. If oxygen is low, you'll be given oxygen through a mask or tube to help you breathe easier. 2. Giving medicines through a drip IV line. You may receive medications directly into your vein to work faster, such as diuretics, water tablets like furosemide, Lasix to help the body remove excess fluid. This quickly reduces swelling and improves breathing. Vasodilators like nitroglycerin to relax blood vessels, making it easier for the heart to pump blood. Inotropes may be used in severe cases to make the heart pump stronger. 3. Running tests to find the cause. Doctors will try to find out why the heart failure happened. They may do ECG, heart tracing, to check your heart rhythm and look for signs of heart attack. Chest X-ray, to see if fluid is in the lungs. Blood tests, to check kidney function, electrolytes, and heart damage markers. Echocardiogram, heart scan, to see how well the heart is pumping. 4. Starting long-term medicines. Once you're stable, doctors will start or adjust medications you'll continue taking at home to protect your heart, such as ACE inhibitors or ARBs, help relax blood vessels and reduce heart strain. Beta blockers, help slow down the heart rate and strengthen it over time. Diuretics, continue to remove excess fluid. Aldosterone blockers, help control fluid and protect the heart further. 5. Diet and lifestyle advice before discharge. Before you leave the hospital, the healthcare team will teach you how to manage heart failure at home. Limit salt and water intake. Monitor your weight daily. Take your medicines exactly as prescribed. Avoid smoking and alcohol. Attend regular checkups. In simple words, in the hospital, doctors help you breathe better, remove excess fluid, strengthen your heart, find the cause, and teach you how to manage it so it doesn't get worse again. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, leave a comment below, and share it with your friends or family. It might just help someone who needs this information. And don't forget to subscribe to Dr. Next Door for more simple and clear health explanations every week. Stay healthy, stay informed, and see you in the next video.